So our main findings that I think should be highlighted were one, in addition to about 80%, as I mentioned, of physicians that recommended TSH suppression in patients with intermediate risk PTC, almost half said they would do this in patients with low risk PTC, and almost 1/3 that they would do this with patients with microcarcinoma, which is quite concerning. Physicians with higher thyroid cancer patient volume were less likely to recommend TSH suppression in low risk and very low risk PTC patients. And it is possible that this is because they were more aware of the guidelines and had more personal clinical expertise in treating thyroid cancer patients. But what was interesting was that there's been a lot of literature looking at surgeon volume and surgical outcomes in thyroid cancer. But there's not a lot of studies looking at physician patient volume and medical management of thyroid cancer. So this was an interesting finding. As I mentioned, this was expected that physicians who estimated higher likelihood of recurrence were also more likely to recommend TSH suppression in these patients with microcarcinoma. And just under half of physicians who did recommend TSH suppression in low-risk PTC and microcarcinoma patients said that would continue for more than 5 years.